Well, good afternoon, everyone. I'm Reverend Tony Alexander, Assistant Pastor at Purpose of Life Ministries, and we are at Purpose of Life Ministries, 3705 Kessler Boulevard, North Drive. We're getting ready to have a lunch and learn, in which we've got a lot of folks here from that are from the central Indiana area, and we're going to be having a forum that's going to update all of us on Medicaid changes in Indiana. There are a lot of changes that are coming forth, and what we are going to try to do on today is we're going to try to make it an opportunity where you can catch all of those changes and make sure that if you were not aware, that you know what all those changes are, and that you make sure that you are adequately prepared and ready. So we're getting ready to get started as Pastor Green, Senior Pastor, Purpose of Life, is getting ready to do a welcome.
Good afternoon, everyone. And continue eating. Just keep going, keep going, keep going, keep going. I just wanted to, first of all, those of you who may not know me, I'm Pastor Green, Senior Pastor at Purpose of Life Ministries. We are doing this today because we want people to know what's going on with Pathways. We're happy to have our lead speaker here, the President, CEO of SACOA, Mr. Tarek Brown. I can happily say I helped get him to our city from Michigan, and he's been doing a great work there at SACOA. I wanted to hit a couple of housekeeping items. If you need the restrooms, they'll be out the door to your left. Then the first door on your right and the second door on your right will be the restrooms. Also, I wanted to thank Miss Lisa from Careforth for providing our food. Amen. Amen, because we all like to eat. Amen. But most importantly on today, hopefully I want all you to get your questions answered as best we can. If Tarek doesn't know, probably somebody else in the room does know. So we're happy to have all of you here. And again, we want it to be your session. We're doing this because we want to get information out in the community as our great state passed a law that goes in effect on July the 1st. And, if I had known a lot more sooner, I would have done this sooner. So don't be mad that it's here at the end of May that we're having this. But we want to try to get the information out, and hopefully you share the information with your relatives and family and friends and neighbors as well. Come on in. Let them on in. Come on in. Come on in. And so we're going to turn it over to Tarek. And again, make yourself at home here at Purpose of Life. We love people and we love the community. Tarek, we're in your hands.
Thank you. Thank you. Can I use this stand here? Good afternoon, everyone. I want to first thank Pastor Green and Purpose of Life Ministries for making this opportunity possible for me to come and speak with you about this program that will begin July 1st. Can everybody hear me okay? All right, very good. I thought about how I would frame or start this discussion with all of you today. And after much reflection and obviously listening to my higher power, I thought it would be a great opportunity for me to frame this in a current state scenario and future state scenario, which is to say, what does this system look like today? And what is it going to look like come 1 July? I want to start out by sharing and reminding people that when the Affordable Care Act was signed into law, there were some expansions made as it relates to Medicaid. Many states across the country opted into those federal expansion items as they were written, and other states did not. Why is that important? Because in the state I came from, in Michigan, Michigan was one of the states that said, you know what, we like the Medicaid expansion rules that the feds have written, so we're going to opt into that. When they did that, the clock started ticking on them to move their Medicaid waiver programs into a managed care environment. But here in Indiana, they did not opt into the federal rule as written. They created what is called HIP 2.0, or the Hoosier Incentive Program 2.0. And what that did was it allowed them to run Medicaid waiver as it had been being run, with an understanding that at some point in the future, they would have to move that Medicaid aged and disabled waiver program out of the traditional fee-for-service environment or model into a risk-based, capitated, managed care model. When I say fee-for-service, what I simply mean is it doesn't matter how much service an individual needs in a Medicaid fee-for-service environment. All of those services will be provisioned, they will be delivered, and they will be paid for. So that is the current state environment here in Indiana with the Aged and Disabled Waiver Program. This program that I'm speaking about today only impacts those individuals on Medicaid waivers who are age 60 and above. It does not have any impact on those individuals younger than 60 or part of the traumatic brain injury waiver program, the health and wellness waiver program. The child waiver programs are not part of Pathways to Aging. So Indiana has chosen to design a program called Pathways to Aging. And this is where that future state of what it will be come 1 July. The program Pathways to Aging will be a risk-based, capitated program for individuals 60 and above, where they will have one of 3 insurance companies as what I call their care managers and supports coordinators. Those 3 insurance companies are Anthem, United Healthcare, and Humana. In the current state, organizations like mine at Sequoia Aging and In-Home Solutions, there are 15 agencies like us in the state of Indiana. We are the care managers for those individuals today, 60 and above. So you can see that will be a shift. That will look different. The case managers that are Medicaid waivers 60 and above participants have today will shift to one of those 3 managed care organizations that I previously mentioned. Those will be the care managers of those aged and disabled waiver participants 60 and above. Sequoia and the remaining 14 area agencies on aging, which is what we are by federal designation, and several independent care management organizations that exist here in Indiana, such as IPMG, CareStar, there are maybe 5 or 6 of them that operate here in Indiana. We will take the role of what is called service coordination. So instead of us being care managers and pathways, we will be service coordinators. The first thing that is going to occur let me go back. Around January of this year, the state of Indiana sent a bunch of letters to existing Medicaid waiver members age 60 and above. And in these letters, what you would have read is Pathways to Aging is coming. You will need to make a selection between one of these 3 insurance companies. And should you not make that decision and let the state know by April 30th that that individual would be passively assigned or passively enrolled with one of those 3 health plans. So if you got a letter at your home and that letter told you to make a choice between one of these 3, but it didn't get back to the state, chances are you have been or will be passively assigned to either Anthem, United Healthcare, or Humana. It's also important to know that the state wants all of their members aligned. And people say, Tarek, what in the world does aligned mean? What it means is if my Medicare Advantage plan or my traditional Medicare is with Humana, then so will my Medicaid. It will no longer be acceptable to have Humana as your Medicare Advantage insurer and have Anthem, as an example, as your Medicaid home and community-based service insurer, which is essentially what Medicaid waiver is. It is home and community-based services. So that alignment is important to know, because if you already know what your Medicare Advantage insurer or who your Medicare Advantage insurer is, then you can probably guess that you're going to have that same insurance company as it relates to pathways to aging. So now that we've come from that April 30 forward, now the state is in a place where they're a little less than 5 weeks out from go live. There are still many questions that haven't been answered, right? Many questions that have been asked. We've not gotten complete clarity on how certain things will go. But what I do know is this. Having been through an implementation in the state of Michigan, it was designed very differently than how Indiana has designed it. There are a few things that I do understand and I could reasonably predict to happen. The first of which is services on care plans, right? That's what everyone wants to know. Tarek, are my services going to be decreased? Are they going to go down? My answer is I don't know beyond a certainty that is going to happen. But if I lean into my prior knowledge and experience, I can tell you that it most likely will. They are going to be focusing on the right amount of care and the right frequency of care, which is to say, I may have an attendant care person coming into my home providing attendant care for me for 8 hours a day, 5 days a week. I may not need all 8 of those hours 5 days a week. And so those are the kinds of things that they'll be reviewing, assessing, and determining what is best. So I don't want anyone to come into Pathways thinking everything's going to stay the same. It is a very different environment. When you hear capitated risk-based, that means that each company has an allotted amount of resource to provide care to beneficiaries and nothing more. Should they go above that, the state is not paying that excess money. The health plans will have to cover that amount. So there's another difference between fee-for-service and managed care. Fee-for-service, the state would continue to pay it. In a managed care environment, that's done. That won't continue to happen. So I want to kind of start it there, and then I know you have so many questions that maybe you want to ask. I would love to hear from the audience now that I've kind of teed this massive system change up. I want to hear from you all to get your feelings of what questions do you have and how I might be able to help. Yes, ma'am. Yes. Yeah. Medicare eligible. That's a great question. So I'll answer it this way. If let's say I'm a Medicaid member today, right, and my Medicaid is with Anthem, but I'm not quite old enough to become eligible for Medicare, okay? When I become eligible for Medicare, they will have me move to Anthem initially, but it's still the member's decision whether they want to stay there. So in other words, if you were to become Medicare eligible and you also are Medicaid waiver, you will only have those three options. If you're not Medicaid, then you can select whichever insurance company you want if you're Medicare only. That's right. You will have to be aligned at that point with the same insurance company. Yes, ma'am.
Is traditional Medicaid no longer available?
It is. Pathways, so there are certain, I'll call them situations where an individual is carved out of pathways. Traditional Medicaid members, individuals on hospice. So there are a few specific conditions. But again, this is Medicaid waiver, aged and disabled, 60 and above, who are currently in that system of receiving home and community-based services. It is not the traditional Medicaid that you're speaking of.
Someone that's making application for Medicaid right now,
Yes.
they're not yet approved,
Yes.
severe stroke patient,
Okay.
so traumatic brain injury.
Yes.
Can they, and they have, because they're 70, above 65,
Yep.
they have United Healthcare and Medicare.
Okay.
Can they move to traditional Medicaid?
Okay. That may be, that I do not have an answer for. That's more complicated, more of a one-off scenario, but we'll have to take that back and see can we get you a response to that, ma'am.
Okay, and then secondly, for SACOA services,
Yes.
that same situation, they are impacted with their speech. SACOA received an application from a care manager case plan with United Healthcare,
Okay.
but refuses to acknowledge it because they're stating they need that person to say, yes, I want the service. And that person can't
Can't do
return
it. They can't
home,
do
and
it,
they
right.
can't say, until SACOA has home health services in place, but they can't say, yes, I want the service. They have a POA,
Okay.
and I would like to know how to navigate through this situation.
Would you stick around after we're done? I'd love to get some information from you.
Thank
you know,
you.
look, I was speaking with this young lady here a few minutes ago, and one of the things that I love about these kinds of interactions is I like being challenged. You have to tell me what isn't happening the way it should, because how do you expect us to get better if I don't know what the challenge is? So I appreciate you sharing that with me. I want to connect with you after we're done. Yes, ma'am. Yes, sir.
Yes, sir. I just want to get back to the beginning. How did we get here? Because at the beginning you talked about the letter that should have been sent to people, and I guess I need a clarification on that definition. As I wrote it down, and this makes it a little simpler, I guess. What causes this letter to be sent to an individual? Most of us either have somebody in our family that's on Medicaid or Medicare,
Yes.
or we are on it ourselves. So if we missed it, I don't even know if it was sent out to us at all. So if you could kind of expound on just that definition, that way you kind of know where you are in the program.
Yeah. So to clarify, all of the individuals who are currently in a aged and disabled waiver, 60 and above population, and are currently receiving services through a care-managed organization, right? SACOA, the other area agencies on aging, who receive that information, do their level of care assessments, go out and develop those person-centered care plans, and then connect that individual to services. So what the state did is they pull state data that tells them who all of these beneficiaries are who are currently drawing services through that Medicaid waiver program. And from there, the state, not SACOA, not the other care management organizations, the state then sent letters to every individual stating introduction to pathways. You have to select, right? So there was it kind of introduced the program, then it moved into what needed to take place. And that was the onus of the recipient of that letter. And it would have told you to call a certain number, 1-8-Pathways-4, to select that particular health plan that you wanted to connect with and be a part of the Medicaid waiver program with. Yes. Yep. We were talking about that, yeah. I've got her on my list of, yeah, absolutely. Gave her my business card, told her to send me all the information and let me look into it. You were back there when we were talking, by the way, so see. What other questions? Yes, ma'am. Okay.
Okay, I am working with my mom, who is in a nursing home.
Okay.
And I didn't see the letter. I looked everywhere for the letter, and I didn't see it. But anyway, she lost her Medicaid. And we're
Okay.
in the process of trying to get it back.
Okay.
And when I called Pathway, the first thing they asked for is her Medicaid number.
And you don't have it.
I don't
because
have a
it's-
number.
Okay.
But when I called FSSA,
Yes.
they said that we submitted her paperwork, but we submitted it late. So is there a chance that she will get it back, or?
There's always a possibility that she will get it back, but I will say currently the Medicaid waiver program is on a wait list. So they are not bringing new individuals into that program in the current fiscal year that won't expire until 30 June of 2024. So I say that to say you may get a definitive answer between now and then, but just know, should she resume or get that Medicaid confirmed again, I would expect that to not happen till closer to the end of this fiscal year.
So how does she sign up for Pathway then? So she can't?
Well, she will, if she's Medicare and Medicaid in a nursing home, chances are they probably will have to do something to get her into one of the plans. That's a unique situation, more of a case-by-case basis. I can't answer what FSSA may or may not do, and specifically the Medicaid office for her specifically. I don't have an answer for that. Yes, ma'am. Okay.
I just got my letter from Pathway of Aging last week, and I'm pretty satisfied with Humana.
Okay.
Because I've had them before.
Mhm.
So they're not asking me to just like choose something different, right? If I
No.
already- Okay.
It's your choice which one you want to deal with, and if you select Humana, they should allow
Yeah.
you to select and keep Humana.
Yes, because I've had Humana for maybe like the last 3 years. I'm very satisfied with them.
Okay,
Like what they do.
very good.
Now, back to what Miss Mary was saying.
Yes.
When they told her your papers never came in on time, they be fibbing. Let me tell you why. When I was calling concerning with my mom when they cut her off in July of last year,
Yes.
they told me the identical words, what you just said. And I asked her, how could the papers never reach you when I never mailed them? She couldn't tell me nothing.
So when you say they, can you clarify they?
The F-
You talking about FSSA, Family and Social Services Administration? Okay. Yeah. Yes.
Okay, I was wondering if there's any way, this is Sister Mary, that the nursing home can expedite that Medicare because they did it for my sister.
Okay.
I couldn't get it.
Okay.
I couldn't get her back on Medicaid. It had to be renewed, but the nursing home took it over and they were able to get it like almost instantly.
Well,
So-
I can say there are a couple of nursing home professionals in the building and in the room with us today. Mr. John Jones, are you able to answer that question?
I do not have the answer right now, but if you give me, I'm going to give you my card. I can get you some more information. Is that fair? Please.
Oh, very good. Need a mic. If you need a mic now.
So for individuals that have been in a nursing facility and they've lost their Medicaid, I mean, it can be for a couple reasons. You know, during COVID, we did not have Medicaid redeterminations. So when the public health emergency ended, all those Medicaid individuals had to have their assessments done and, you know, their Medicaid eligibility redetermined. So if you didn't see your letter, if you didn't respond, you lost your Medicaid. So the nursing facility, the social workers, they can definitely help, but they're also dealing directly with the local Division of Age, or not Division of Aging, DFR office, Division of Family Services, or Division of Family Resources office. So for this lady right here that said you turned stuff in, but they said they didn't get it, I mean, we hear that all the time. Take it to your local office, have them stamp it, they will upload it that day and it shows that it was received. It didn't work? Did it not work? Yeah, I see what you're saying. Yeah. So yeah, well, I'm sorry that happened. But you know, if you did lose it, yes, get the documents in. They're going to review everything. They'll probably go out and maybe make a home visit or go to the nursing facility. The social worker inside that facility will help to coordinate it all and hopefully get those benefits back in place. Mm-hmm. Yeah. 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 It happens. You just have to either go down to your local office or when you do call, you know, just be persistent and keep calling, keep resubmitting, but, you know, find a good case manager that will help you. SACOA will help you with that. If they're in a nursing facility, they'll help with that. Also, like with your Pathways for Aging letter, so if you did receive that letter or you didn't receive it, like Tarek said, you know, if you didn't respond and select one of the 3 managed care organizations, they'll assign you one, but you can always change. So it is all about choice and doing what's best for you. Okay?
Thanks, Lisa.
Okay, that glad she mentioned 3 providers, because if we got 3 people doing the same thing, then the flavor has to be different. And which one is going to describe the flavors? I mean, if we could, of the 3 different people who are going to be the plan providers.
So each of these plans, I'll answer it this way, and I wish I could give specific details, but I just don't have them. In fact, the enrollment broker that is helping beneficiaries select one of the 3 have been asked ad nauseum, what is the difference between Humana, Anthem, and United Healthcare? From a what can I expect from them, from one that's different from the other? Or as I used to say in my for-profit business world, what's your key differentiator, right? And it's not as easy to identify what that key differentiator is. What I can say is that all of the waiver home and community-based services will be universally offered across all three of them. But United Healthcare, this is an example, United Healthcare has made significant investments nationally into affordable housing. So if I was, if I was thinking about this, I might say one of their key differentiators could be that they're trying to do some things in that housing support space for individuals older than 60. Humana has a focus on home accessibility and safety. And so it's reasonable to assume that perhaps Humana may be focusing more on home mods, gutter cleans, those kinds of things that really can take a toll on an older adult's home. And then with Anthem, I've not really heard what's unique or different other than I do know that they have a lot of programming across their other lines of business in the family caregiver space. And so I could, reasonably assume that they may be doing some unique or different things in that home or in that family caregiver space. I know that each of them have different benefits around, grocery and gift cards and things like that. But I'm not the expert because I don't work at either of those three entities. I'm just sharing the information that has made it to my ears as I'm out here in the community asking a bunch of questions of people that are out and about. And these are the things that I'm hearing. So I know it's not a specific answer to your question, but hopefully it gives a little more color around what I'm seeing in the communities. Yes, ma'am.
With the managed care providers, do they have options to increase the plans that you can subscribe to? For example, you mentioned limited services.
Yes.
Or managed services. So if one plan says they will offer 60 days of therapy, can I purchase a plan that would give, say, 90 days of therapy? Are those options within each one of these companies?
So that's a great question. What you're explaining in my mind is more commercial clients that are part of those companies. I would say within Pathways specific, probably no.
No, okay.
But if you wanted to do something in a different line, that could be an option, although I don't think that it would be. And the reason I'm saying that is because, all the data that's being or going to be collected as a result of this project, we would expect it to stay within that constraint of home and community-based services and what is already allowed. And so I wouldn't see many instances of them allowing someone to buy up something different or to option something different that might be on the periphery of Pathway services specifically. I think this gentleman here had a question. Had his hand. Yep. Yes, sir.
I really don't know what my question is, but I would like to talk about a scenario at my home, then I'll ask my question. My question is this income driven? You have to be at a certain income level in order to qualify yourself for that?
So Medicaid does have a financial eligibility component. Mm-hmm. I will say I'm trying to remember what exactly that monthly income cannot exceed. Lisa, if you know that, would you? For Medicaid eligibility for waiver? Yeah.
Okay. Now,
Thank you.
I'd like to make a statement now. My wife she had a Medicaid disability waiver.
Okay.
And an old age waiver. She had two of them.
Okay.
Pre-COVID, we had a person coming in to care for her. And we weren't satisfied with safety measures, so we asked them not to send us anybody.
Okay.
And they said, well, would you like to take it yourself? Would you like to be your wife's caregiver? I said, I'm not looking for a job, but I'll take it. Matter of fact, I was telling Pastor Green about it. And so they was giving me a little income every couple of weeks. And when it came time to requalify, they took and added what they paid me onto what our household income was and disqualified her for exceeding the amount that was allowable. And that's where we are right now. Real live scenario actually took place. And so then when I came, I said, I don't want to say anything negative about this, but it's in the appeal process. She had the Medicaid waiver. And because of the dollar, it overrode her physical condition. And they disqualified, took away from her what she had. Disability from working, got disabled, disability waiver. Now she's in the old age category, so she had two waivers. Disability waiver and the old age waiver. And the income, household income, exceeded the amount that was allowable, whatever that was, and disqualified her. And so when we came today, we said, we didn't know how it was going to be presented.
Sure.
But this is real live, what we're talking about.
Yeah.
It's something that actually happened. And when we have situations like this, oftentimes, people will think that it's this when it's actually not. And you have to be dirt poor to get in the program. So is Pathway to Life, or whatever your program is it income driven? Because you can get into it, and after a while, they'll disqualify you.
It is income driven. First, I appreciate you sharing your story, right? I mean, these are the kinds of conversations that we have to be willing to have as community members, right? I was not aware that a spouse's income impacted a Medicaid member's eligibility.
Yes, it does.
Because, again, and I understand every state operates differently. The state I came from, it's not like that. It's only the recipient income that is factored in to whether or not you're Medicaid eligible or not. So it's really unfortunate that this has occurred. Do you know, and are you willing to share, have you been able to reestablish that Medicaid eligibility for her if you're not providing that direct service care? I believe what you're talking about is you were serving as an attendant care provider, as a legally responsible individual, and being reimbursed, right, for those services rendered, correct? Are you still doing that?
No, when they disqualified her.
And so that means
They disqualified, they took her completely off the program.
And so since her
all
income,
the benefits that she was getting prior to,
okay,
they
and
even took those away.
and
But
so,
she's still in the same physical condition.
right. And so my follow-up question, sorry, I want to have this interaction because this is really good. This is really, thank you, sir, I appreciate it. This is really good. So since she's not on the program, but the physical conditions still exist, have you attempted to get her reapplied for eligibility for Medicaid?
Yes. And, but after we sat down and thought about it all, we said, well, we don't really need that drama. But then she was getting the benefits prior to us finding out that they had an income level that you had to either be above or beyond. And where we are now is they asked us if we wanted to appeal the case.
Yes.
And we did that. But what we found out in trying to re-enter the program, we found out also that the bank, this is real. This is really real. The bank was sending in our bank statement to Sequoia. They knew all of our transactions, and they knew that. They knew that. And when we received a form from them, when it came time to reapply, I asked the question, well, how did you find out all this information? My bank deposits from my job. I'm a General Motors retiree.
Okay.
I'm a Social Security recipient. Had a little part-time job working at a golf course because I like to play golf.
Me too.
Everything, all my bank transactions, they knew about. Everything. And we want to know how they found all that out. But the bank reports to them everything that, all the activity that anybody that's in the program, all of your information goes into them. So they know everything about you. And it's borderline, if you tell a lie, they got you. And so we need to know all these things, all this information. We need to know all of that before we get into that. Because we actually experienced this. We didn't even want to come because we didn't want to share, because somebody might think, well, it's a negative situation and here's a player here or something like that. But this actually happened. Yeah. But she's still in the same physical condition. She had a Medicaid physical waiver. She was physically unable. Worked all her life, and then she got in a bad condition. She can hardly move now. And they took it away from her, disqualified us from the program because of the fact the money that they paid me for taking care of her was added to my already established income, which disqualified her from the program. Yeah, disqualified me from being her caregiver.
So I'm sorry, I didn't mean to cut you off. Did you have more?
A whole lot more.
Okay, well, let me answer, and
it's good for us.
Oh, absolutely.
We don't know about things because we don't talk to each other. Yeah. This actually happened, and if I had the time, I don't want to hold up nothing. I've got a whole lot more that we've learned from being in the program, and it was just a bad experience.
I'd love to connect with you at some point after we're finished as well. I will say that part of the Medicaid redetermination application process, those are requirements that we have to collect and submit to DFR to get a Medicaid application, redetermination, reassessments, all those things. It's not us that's saying we have to have this. It's a requirement by the state that we collect that information, banking information. If there are IRAs, if there are 401ks, we have to see and have vision on that. Not from the Sequoia stance, the state must have vision on that to make a determination of whether or not an individual's above or below that eligibility or income eligibility level. So I don't want to give the impression that that's not a standard practice and we wouldn't collect that. If anybody was applying for Medicaid, one of our options counselors are going to say, we need to see all of these things as part of the application. It must be submitted to the state. Should you decide not to do that, I can tell you you're probably going to get denied because they just don't have enough information to make that determination. But that being said, I do understand exactly what you're sharing. I appreciate you sharing it. And like I said, I want to stick around a little bit afterwards to speak with you. I might be here all afternoon. When I look at Sonia, she's like, you might be. Yeah, so in Pathways, every year they'll still, the question was, in Pathways, how will the redeterminations and all of that go? to maintain that eligibility each year. So when Pathways implements this first year, it'll still be the existing agencies doing that work. So the area agencies on aging, of which SACOA is one of, will still be doing the initial level of care assessments, will still be assisting individuals to fill out and submit their Medicaid applications. That will end on 30 June of 2025, and that function will shift over to Maximus, who will then do all of the enrollment stuff, level of care eligibilities, Medicaid application work, and then once that's submitted, what I could expect to happen, Pastor Green, is that the state, the state and the MCEs, right, a joint effort, would notify members of if eligibility has been changed or if it's going to be changed. I still believe that information would flow from the state to the beneficiary, but I do not know exactly how that is going to work. It's a best guesstimate at this point. Yes, ma'am.
I'd like to give you, first of all, I have a little problem with my voice, so I hope you all can hear me.
We can hear you fine.
Okay, I have another, like Pastor Bradley, home. Give me a minute. I have a just situation to share with you. This is real.
Okay.
I am somewhat disabled, mobility more so than others, but again, I have my disabilities. I live with my 77-year-old husband, who is also disabled more so than me. We've been together 32 years, going on 33.
Congratulations.
So therefore, I'm a registered nurse and knew what I was maybe getting into when
Sure.
we first married. Okay, here it is. We applied through SACOA for some care. They said that our income was greater than what we could, qualify for.
Okay.
So now, my next question is about Medicare waiver. What does it do in a situation like this? A friend of mine who has a home health agency said, you all just get a divorce, that'll take care of it,
We're not going to promote that up in here today now, I can tell you that.
She said, get a divorce and you can get it all then, both of you. However, we don't qualify. We're over the financial limit to qualify for any kind of care.
Okay.
Not exactly in a situation to be able to do private pay for the times that we could use it.
So I'm curious to know if when you connected with our agency, if they spoke to you at all about the choice program.
It's been a while. And
Okay.
I mean, a couple of 3, 4, 5 years. And they were telling me they could get things down to where we could pay so much money a month toward getting.
That's
some
the
sort of
choice
care.
program. So
Okay.
choice, the acronym is Choices for Home and Institutional Options of Care for the Elderly and Disabled. Choice doesn't have any financial eligibility, but it is a cost share program, which is to say, based upon your monthly income, you could be asked to pay a share of the cost to receive that care. So the example that I use is an individual who may need home care, okay, as an example. And home care agency is charging $24.50 an hour, again, an example. Under the choice program, the choice grant funding might cover 80% of that. And then the individual receiving that care would be asked to pay the remaining 20%. So there are programs out there that are more, I'll say, appetizing to individuals who know I can't pay private pay 100%, right? And that's a scenario that's real for many of us. And so that's where I explain and have people investigate the choice program, because there could very well be an opportunity to get some services started But just understand there could be a sharing cost or sharing in the cost of receiving those services.
Okay, well, it hasn't, thank God, but should it get to the place where neither one of us anymore could take care of the other,
Yes.
the choice program, would one of our incomes cancel out the other in
No.
terms of eligibility?
No, but I'll give you some information before I leave today so that you can, properly look into that program, get a better feel for how it works, what that cost share scenario kind of looks like, and then you and your husband can make those decisions of when that time does come, and you do maybe need to lean in and reach out to us, that you at least come, you're calling going, I want to talk about choice.
Right.
I don't want to talk about waiver or this or that. I want to talk about choice.
Yeah.
The other thing that I will tell you is the other funding stream that we do provision services for and contract with providers in central Indiana to deliver is through the Older Americans Act. And the Older Americans Act is not a cost share program, but it's limited in the kinds of things that it offers. So, it will do things like home delivered meals. It'll do things like some transportation, some in-home care, right? So Older Americans Act is another option for you to pursue with us should it not be choice. Okay?
Thank you.
Does that help? Very good. We have 5 minutes left.
I guess with the three that is going to be selected, and you have to go with one of them.
Yes.
I'm just going to go with another statement. My sister stay in one zip code, and someone else that she knows stay in another one. The difference, $225 for grocery, or $250 for grocery. Under her care, she get $100. So what I'm saying, why are we targeting the zip code and the folks that's needed? I'm going to say we almost need to boycott old people's. We need to go and boycott because look like our way of living is worse than if we look at the younger areas and all of that. These people is in a need. As Pastor was talking about, his wife is in a need, and Sister Hutchinson, she need for her husband and herself. Look like that the politician, I know our pastor is fighting, look like we are fighting for the wrong reason. People can serve all their lives and get to this point and go under, lose their house, and their indignity and their sanity. They lose all of that because they got an illness in their home. I know another situation with my brother-in-law. He worked at Chrysler. He is disabled, is not able to even take care of himself. They put out an issue that's saying, if you got someone, your loved one is taking care of you, they can be paid. And we go back to a pastor saying the same thing. His wife got to wait on him every day, but she overqualified and then didn't qualify for him because they made too much money for someone coming in there to give him a helping hand. Something wrong with that program. Altogether, I know you're a sports person for it, but I'm saying here's some serious stuff going on. That people that is unable to do things for their loved one, it's just taking their hearts out.
So I'll respond this way. Thank you for sharing those stories. I'm not a spokesperson for anything specific. I'm a spokesperson for my agency and for my aging community and disabled community, and that's it. This program isn't something that I designed. It isn't something that, many folks, yes, they did a bunch of stakeholder design groups to kind of help walk this out. But there is a large part of me that believes there could have been a different way to approach this than where we've ended up. So I'm not here in support of or against pathways. I'm here trying to bring a message to my community members that simply says change is on the forefront, and many of the change that some of us in this room will experience, we're not going to like. But trust when I say, I understand what each and every one of you are saying. I get the challenges that we face, and I pray God that those challenges get better over time. We'll just have to wait and see. That's really all I can say to what you've shared, but I do appreciate you sharing today. I'm sorry, go ahead, Lisa.
But thank you. But we want to make you aware of what's going on, and we want to be able to help guide you, help you navigate. And, even if we're just a shoulder to listen, I mean, that's why we all do what we do, because we care so deeply about what's going on in our community. I know Tarek said he wanted to speak to a few of you later. I would like to speak to this pastor, but also this couple right here where you lost your Medicaid due to income eligibility. I can help with that. It's all about looking for resources and finding the right people that can help you. So reach out to Tarek and to Sokoa. Reach out to us. That's all I really want to say.
And let me add this as I close. First, I always love being in front of groups and talking about things that are important to me and things I'm passionate about, things that my grandmother put in me from the age of 7 till she passed away several years ago. You do have a voice. Each and every one of us have elected officials in the state of Indiana. Sometimes change comes about because of calls that we make, because of letters that are written. And so I've always said, if you feel a certain way about something, or you think it should be different, then it is critical that you activate your advocacy voice. Because without that, nothing will change. So thank you very much for giving me the opportunity. Again, thank you, Pastor Green, for making this available for me. It's been great speaking with you all, and I will be around for a few minutes. Thanks.
Just before you get out of here, just a couple things I do want to recognize. In sharing all your comments, there were a couple people that are related in terms of politics sitting in the room to hear your feedback, so I think that's important. We have the liaison for Senator Todd Young, Miss Ronnie Ford, she's here. Also, our state representative, Mr. Gregory Porter. So they're hearing what you're saying. Come on, give them a hand. Because a lot of times those ears are not in the room because they have to hear what you have to say, because you do have to advocate for this stuff. Because they're making changes and shifts, and Tarek was just the messenger. Never shoot the messenger. The messenger's just saying, here's what's coming down the road. And it's better to know that the train is coming than to sit and say, okay, I didn't even know the train was coming. So he was just the messenger, but I know him well enough. Those of you that he asked to see him, talk with him, he will give you a straight answer because I know him that well. We work together. And we have to keep an eye on all this stuff. Because when they go to doing something new, there's going to be a lot of cracks. And there's going to be a lot of people who fall through the cracks. And if we don't communicate and you don't share, then we can't pass it on to help to get people out of something they may have fell into or know what their options are. Those of you know Pastor Green, just, hey, those of you members of Purpose of Life, you know, if you let him know, he's going to let somebody know, say, hey, now this is going on, and we need to address it. And because we have to pass that on, I believe those relationships do make a difference. All right, any other question? Did you get enough to eat? You're good? All right, HB, thank you for coming and sharing, getting this message out as well. I thank, again, for the food donation from CareForth. Yes, we got the Marion County Council of Aging present as well. Go ahead. All right, that's the Marion County Council of Aging. That's the second Thursday of each month at 9 o'clock at the 9:30 at the Sokoa building. It's a great organization to be a part of because it's making a difference because we got to keep people informed. Those of you that are even caregivers, we got to keep up on this information and we got to share because most of you probably learned some things today. I guarantee you your neighbors and other family members don't know, but they need to know, because they're going to start experiencing things differently come July the 1st. I mean, I just want to emphasize this. So, Tarek said it, hey, they got a right to do an assessment, basically, of you when you get one of those three. And so your assessment may come back different, right? It doesn't mean it's going to match what it used to be. Because, you know, we don't like change. But they're going to do a different assessment. And if you understand the dynamics of money, they're going to try to give you less because they're trying to make some money. None of the three are in it to lose money. All three, Humana, Anthem, United Healthcare, they're all about making some money. So if they're going to do this, they're not doing it to lose money. They ain't doing it to give you more services and lose money. They're doing it to say, how do I give you something and make some money? All right? So we're going to have to be on top of it so that people don't lose the care that they truly need. So please, ma'am, please, sir, share that. I ain't mad at none of the three. I ain't endorsing none of the three. But I understand business, Deacon Dumas. Ain't nobody in business to lose money. Amen. Nobody's in business to lose money. That's a going out of business strategy. They're in it to make money, but we got to make sure people get the services they need, because I'm with Deacon Daly. If you served all this time and did what you're supposed to do to wake up broke and homeless, that ain't cool. All right. Thank you, everybody, for coming. Thank you for your time. Feel free to fellowship, and hopefully you have a great day. And please share this.